Okay, so shin splints. Posterior shin splints are felt in the medial distal aspect of the lower leg here. Anterior lateral shin splints, which is most common, felt right here. Okay, so right here. Okay, so we have tib anterior right by the crest of the tibialis, right here. Tib anterior, just behind it, we have the peroneals, right? Longus, brevis, tertius down here. Lateral ankle sprain recovery, I want to use caution with this kind of thing, traction and range of motion. Or some people, like with Claudia right now, you get a little chronic.
That's a correct.
Right?
10 years ago.
There's this divot here, right? The talocrural joint, where the talus meets the foot. Right? Talocrural joint is just a fancy word for ankle. Okay, and here I'm continuing using my thumb on the bottom of the foot this way. Like that. Okay, so working the tibialis anterior. I always, for a long time, I kind of dreaded when people would come in with shin splints because it just seems so, this muscle is just like, it's little, but it would take a lot out of me. So I'll show you my hack for it. Right, and kind of doing this thing, it was just like, I would just like grind on people to no end. But what I found was really helpful was this, kind of coming down in here and just leaning on it. Super easy. Okay, and if not with hands, you can do it again with the blade of the ulna. Just be careful that you're not digging into the tibialis crest. Okay, so what I'll do is I use my thumb as a guide rail here and make sure that my pressure, so I'm putting my thumb on, or you can use any finger, on the crest of the tibialis and making sure that my pressure is not there. So I've got to find there. I've got to find a way for my arm to fit in that isn't on the bone. Does that make sense? Just as you get used to it. It's like these are the training wheels. Okay, and then be careful with this because this can hurt people a lot. And do we want to hurt people at all? Mm-hmm. No, so we want to get it to that point where it feels good and it feels helpful, not that where it feels hurt. Does that make sense? Mm-hmm. Okay, if I'm in a chair or down here, again, bowing up that way. If anything's too much, let me know, okay? Or if you'd like more. Okay, so kind of bowing up like this, and I'm just holding. Can I work this way? Absolutely, why not? Okay. Can I work from here but come out this way? So I was coming this way before, but again, with different body types, you're going to get different angles. And this is really safe because if anything goes on the tibia, it's the soft part of my forearm, not the. I have bony arms, so check it out. So while I'm coming this way, this arm is here as, you see that kind of leverage point there? Kind of that's happening. This is on the tibialis anterior, and this is leveraging the leg this way. So we're coming like that. Okay, and I'm using my body to kind of rock their leg, and then you get this really nice medial lateral rotation going on in the hip, which you may or may not want to do. And look, no. I also like to kind of cradle a whole bottom leg because why not? Actually, let me ask. So this versus, right, this extra area of surface coverage versus here. I mean, not the hugest difference, but...
Yeah, but it's different.
Yeah, it's just different.
Can you do that motion again, please?
This one does?
Yes.
The baby cradle?
Mm-hmm.
Okay, so while I'm doing this, I'm just kind of bringing my hand here. And it's just surface area. It's just like just soothing. Right, and I don't want to dig into the ankle. I'll show it on this side too. Okay, so now I'm just using this arm and kind of this. Right, and here's an exaggerated movement. My hand's on the back of the knee, which just feels nice there. And this is easy, and then I can give weight or not. And then you can, no rule against squeezing back here while you're doing this, if you want. There might be reasons where you do want to really isolate body awareness to one area and not distract it. Make sense? I'm not sure what those reasons are off the top of my head, but that's where you get to be an artist. Decide how you'd like to communicate these things. So home and sign, the test to rule out anything serious, deep vein thrombosis in particular, which is a giant blood clot that could be potentially fatal that forms in the deep vein of the leg. So sometimes the skin will be, kind of shiny looking, kind of like a ripe fruit. It looks like it's about to, sometimes not. Sometimes there'll be no visible sign. But if I were to put Claudia's foot in dorsiflexion here, and she says, wow, that really hurts. Should that really hurt? Anybody? That's a red flag. We don't know if it's a deep vein thrombosis. We don't know if there's a stress fracture. We don't know if there's a sprain. We don't know if she stepped off the curb funny the night before and just forgot about it until now. So that's something that you say, yeah, that's not normal. Go get it checked. Don't know what it is. Leave it alone. So that's home and sign is dorsiflexion of the foot, okay? Another way to check for stress fractures is if you feel the crest of your tibia, right? It's quite broad. So I'm gonna feel for the crest of, so there. Her tibia is right there. It's actually a little broader than your tibia. So, right, it's about 1 tsuen if we're using the Eastern measurement. Maybe one of my tsuen, I don't know about yours. But what you're doing is, if you suspect it, is you actually apply a little bit of thumb pressure all the way down that bone. And this is how you evaluate it, right? Here. Okay, so I'm applying specific thumb pressure here. And if there is a stress fracture there, she's going to be like, hey, it's going to feel sharper, right? The thing with stress fractures is sometimes it takes them 7 to 10 days to throw up. So show up. Just because they're not feeling it at that moment doesn't mean they don't have one forming. And I know that's really vague information, just letting you know that might develop. So they should get it evaluated anyway. So that's how you can assess for it. When in doubt, don't put pressure on the tibia. Don't do that anyway. Make sense?
How would it differ actually from a stress fracture, or if there was like a muscle strain? Pain-wise?
There could be both. And here's the thing, there might not be much of a difference pain-wise. That's why pain's weird. There might not be any pain. There could be excruciating pain. Like, usually there will be discomfort in an area because the body's just protective, but people might not know. So how would the pain be different? It might not be, honestly.
Or shin splints and stress fracture could be similar too.
Yeah, and shin splints could be more excruciating than a stress fracture, and because pain's just weird. Yeah. And shin splints, remember, that's also an umbrella term. We're not sure exactly what's going on. The shin splints could be an inflammation of periostitis, which is, let's say the bone has the covering, right? Peri, outer covering. Osteo refers to bone. So that this could be inflamed. Not much we can do about that. So that could be inflamed. Another form of, there could be a tear. There could be none of that, and it's just a sensitive nerve tunnel thing. So we don't know, even on the best day. We're making guesses, So, yeah, even shin splints is kind of a general term. Any other questions?
Some of us are in the clinic now, and for me personally, and probably other people, the rooms are pretty small, and I'm sure in the future we'll work in tiny spaces. So for all of these techniques where you are quite spread out, do you have ways to do that in a tighter area?
That's a good and fair question. So, and this is where like personal movement practice is why I'm such an evangelist about them outside of massage because that's where you figure these things out. But let's say the room I'm in only has up to this line. If you have less than that line in a room, I'm a bit of a diva these days. I'm like, I cannot work under these conditions. Okay? But if you have again, so I can't do this because that's where the room ends. I can't do this. I've got to, let's say it's half that line. I've got to do this. I have to turn my body. I have to turn my body and play with leverage. So here I am here. Does that make sense? Yeah, I can't lean in this way. I have to turn my body and learn to lean in this way, or learn to lean in this way, things like that.
And you can also use the wall as support.
Oh, yeah.
I think we're proposing.
Oh, yeah. Oh, I've done that before, too. You take a wall and you're just like, freak. Yeah. And that's where you should also have a little fun. You're stuck in one of those situations. Any other questions?